Hi, I'm Dr. Jeff McCombs. Welcome to another video in our series of videos on Candida. Today we're going to talk about Candida and blood sugar. Sugar is an important issue to consider with most people, as most Americans consume anywhere from 120 to 140 pounds of sugar a year. And when we talk about Candida, we're generally talking about a diet which reduces or restricts sugars. Now, typically the Candida diet that most people have become familiar with is a diet that was developed in the late 1950s by a medical doctor called Orion Truss. And in Dr. Truss's diet, he utilizes a low carbohydrate diet along with nystatin. And if you read Dr. Truss's research, he didn't place much importance into the diet, but really focused more on the use of nystatin, the medication. Nystatin is an antifungal medication. There are side effects associated with it, and it doesn't work systemically in the body. And generally, when we're talking about Candida, we're talking about a systemic fungal infection. The McCombs Plan is an anti-Candida protocol that is more of a high carbohydrate diet. In this diet, we utilize fruits, complex carbs such as potatoes and yams, and over the past 20 years, we've had great success with this approach. When Dr. Orion Truss created his dietary plan, there wasn't much research on Candida, and we have over 50 years of research and greater understanding about Candida and how it works in the body and how we can effectively control and correct any fungal imbalances that exist as a result of Candida. In utilizing fruits with the diet, we maintain some of the many benefits that fruit afford the body. Fruits contain minerals, vitamins, antioxidants, fiber, and natural fruit sugar. And this is important to the body, as many of the cells of the body require sugar to function. The brain is especially dependent on sugar for function. The 100 trillion bacteria which live in the digestive tract require sugar for function. The intestinal cells which line the intestinal tract require sugar for function. And the immune system requires sugar for function. So sugar is very important to the function of the body, and trying to reduce all the sugars would have detrimental effects to the overall health of the body. Now, can you have too much sugar? Yes. Candida has a higher association in diabetics, anybody with excess blood sugar, insulin resistance, hyperglycemia, and has been shown to cause many other conditions as well. High blood sugar increases the resistance of Candida to the immune system. High blood sugar will also increase Candida's ability to be resistant to antifungal drugs. Conversely, if you have low blood sugar, that can also be detrimental to the body. In 1960, researchers demonstrated at the Rockefeller Institute that low blood sugar levels could also impair the immune system function. Low blood sugar impairs the ability of white blood cells to consume or phagocytize microorganisms such as bacteria, fungus, and yeast. So what is needed is a balanced approach where there is neither high blood sugar or low blood sugar in addressing Candida. Low carbohydrate diets, such as the one that Dr. Truss used, have also been shown to alter the function of the intestinal tract by changing the composition of the bacterial flora. One of the primary bacterial colonies found in the intestinal tract are firmicutes, and firmicutes produce short-chain fatty acids. These short-chain fatty acids have a protective effect for the digestive tract. They protect against inflammation, leaky gut, and in other inflammatory conditions such as Crohn's, irritable bowel disease, irritable bowel syndrome, colitis, and even some conditions that may lead to cancer in the intestinal tract. Additionally, if we try to remove all food sources from Candida, it becomes one of the other triggers that causes it to convert from its yeast form into its fungal form. Once converted into the fungal form, it becomes problematic and distributes itself throughout the body, causes and contributing to many other diseases and conditions. So the idea in addressing Candida in sugar is to correct the imbalance, not create an imbalance. Not only do blood sugar issues increase the complexity of dealing with Candida, but Candida itself has been known to create blood sugar imbalances in the body. Through the use of enzymes secreted by Candida, it can create diabetes, immunosuppression, and hypertension or high blood pressure. Many people will have both hypoglycemia and hyperglycemia, also known as insulin resistance. Our dietary protocol that addresses this is simply to consume a small handful of food every 45 to 60 minutes throughout the day. This, being done over a period of about 4 months, will actually correct these blood sugar imbalances in the body. We commonly recommend that people consume at least 1/3 a stalk of celery every 45 to 60 minutes on the blood sugar protocol as a way to stabilize blood sugar. If this is done consistently for 4 months, we've seen that this commonly will eliminate the blood sugar imbalance. Now, on the McCombs plan, although we usually and typically allow fruit and complex carbs such as potatoes, if you have a blood sugar imbalance, that may be a time when you're not able to do fruit on the McCombs plan. In that case, it's good to follow the blood sugar protocol while following the McCombs plan to eliminate and correct the fungal imbalances of Candida in the body. For more information on Candida, blood sugar, the blood sugar protocol, you can click on the link below or contact us at candidaplan.com or phone us at 888-236-7780. This is Dr. McCombs again, and thank you for joining us.